The Overstood Human Podcast. Unfiltered dialogue, real solutions, no labels. The Overstood Human Podcast exists to inspire people to live with strength, freedom, and a purpose in a world full of noise and division. We champion a life anchored in true health, strong family, personal sovereignty, and self-discovery, inspiring our listeners to thrive beyond the confines of the design system. Our mission is to inspire you to break free from mediocrity, think independently, and live a life of meaning, resilience, and impact. Hello, everybody. My name is Frank Tortorici.
And my name is Sarah Green, and this is the Overstood Human Podcast.
And we welcome you to another thought-provoking episode here today. We have touched on this before, but this I think is a very important topic, especially for you, Sarah. I'm definitely really excited for you to share all this information with everybody, the opportunity that you have lying ahead for yourself, and the ability that you have to help so many more people doing what you do already, but on a grander scale. So, as we know, everybody, cancer statistically, is it safe to say it affects one in 3 people, Sarah? Is that kind of
We're getting closer to 1 in 2.
Oh my God. So yeah, cancer is no joke. We are being bombarded with ways and things and tools to bring it to that 1 in every 2, for sure, quicker than we'd like to see as a society and as a world, for sure. And there's only so much we can do with what we're given, right? I mean, there's so many things around us that are designed to tear our health down. We've talked about that on this show so many times. There's so many things readily available, easily accessible, affordable, that just feeds this cancer industry. And like I always like to shout from the mountaintops, ways, try as best as you can to possibly do to prevent it. There's so many things that are in your power and in your control, like what I do with my Fit of a Farmer philosophy. But we're being bombarded. Look up in the sky, right? The water, there's chemicals everywhere. If you're too dialed into what's going on in the world, the stress levels alone, anxiety, insomnia, cortisol levels through the roof. I mean, there's so many things that are variables here, but the things that we can control, like what's on our plate, how active we are, what we think, where we are with our faith, who we surround ourselves with. These are all the things that are in our control, right? What we choose to listen to, what we choose to watch, what we choose to read, all in our control, every single one of those things. But unfortunately, there's, again, a multitude of things that are out of our control. And when they're getting so out of control that we're hearing of this more and more and more. And there's no greater person that can speak to this like you, Sarah, from what you're doing and what you see on a day-to-day basis. So I guess we can start with let's just hit them with the grand announcement to start, and then we can kind of like carve things out around that. So everyone, Sarah has a huge announcement. So Sarah, the mic is yours.
Well, gosh, I think a lot of you guys know that my practice really, actually, it's a practice that God continues to open doors for. Years ago, if you asked me or told me I would be treating patients with cancer, I would laugh at you because that's not anything close to what I was doing. Trauma surgery was kind of my go-to. But the need is there, and the desire for me to learn more of the natural ways to approach cancer has kind of led me down this path. And my practice is probably 85% cancer patients. And a lot of you guys are aware that I had to stop taking new cancer patients because it just was, I didn't have the time to commit to the ones that were already signed up. And I'd rather have success with the patients that are currently under my care than treat more patients without that success rate. And so I had to, for my own mental state, be able to say no more. And at that time, I just kept praying, God, open up doors to find ways where I could help more patients and add additional things to my treatment protocol that would um, expedite the recovery process. And in that cycle, I was introduced to a couple of gentlemen early December who are just wonderful men. And one of them is a pastor, and the other one has his PhD. And the one with his PhD, he has patented a nanotherapeutic to help target cancer. Their facility is in Tennessee. And when I met them in Vegas, and I wanted to learn more. I wanted to see what it was, because to me it was quite confusing. I wasn't quite understanding, and I knew as a patient coming in with that diagnosis that I would have these questions, and so I wanted to get those answers to questions I would personally have as a patient coming in. So I wanted to see their facility. So the following week, I flew out to Tennessee and was able to witness about 3 or 4 days worth of treatments on patients who were coming to their clinic. Um, I met some wonderful people who were, stage 3, stage 4 cancers and now in remission. This is without chemotherapies and without radiation. Quite miraculous. Although not, I mean, no treatment is 100%, but the side effects and the repercussions of chemotherapy can be life altering and quite deadly. So it was an amazing experience. I flew back home and started recommending their additional help for some of my patients, and just went back there last week. um, I was able to actually have some of my patients who have been under my care, but I have not actually met them, go to the facility. I was able to meet them in person and get to interact with them, which was pretty phenomenal. And they, at the end, we discussed, kind of the future of what they wanted to do, what they needed, and what I could give of myself. And the thought of flying out to Tennessee a couple times a month, although it sounds amazing, puts a lot of strain on my practice that I currently have in California. Um, so I have an amazing office manager, and when I got back home, she said, "Why don't we? 2 doors down is vacant. Why don't we just bring Tennessee to California?" Um, and prayed about it and thought about it and sat on it for a couple of days, and she brought it back up, and I said, Let's ask them." And they agreed. So next week, Pastor Matt Sexton is going to be flying out with his wife Rhonda, and they're going to tour the new clinic that we're going to open up that will bring Dr. Matthew Whiteside's nanotherapeutics to California, and so patients can come to my home state that live on this side of the U.S., or anyone that wants to come to California and get the treatment here. So I'm super excited. I'll be bouncing
Hmm.
back and forth from offices, but it's in the same complex. Um, I also was able to, I've been looking for additional help, and a PA that I've been in touch with who lives in Mississippi drove 8 hours each way to come to the facility to meet me and to witness and partake in the treatment of these patients. And she is now on board. So I will be training a secondary PA who will start taking on more patients, and hopefully we can offer this additional treatment protocol. So more staff, more PAs. That means we can take on more patients. And that's been my goal, is to never have to refuse treatment for anyone who wanted this. And unfortunately, I was tapped out, and I couldn't take on more. But God opens doors, and these people that are coming into my life to help, they couldn't be any more closer to Christ like I am. And so it's just an amazing experience, and one that, um, if nothing else, we lead people to him. And if this is their last days on this earth, because we're not living for this earth, you guys, then we can at least introduce them, if they don't know, who Jesus Christ is and what he's done for us and our eternal salvation if we believe. And so it's another opportunity to minister, which I think these two gentlemen have utilized in their protocols, is really teaching about Jesus Christ. And so it's going to be amazing. As much as I go, gosh, I got to get out of California as fast as I can. Here I
Mhm.
am opening up another facility here, And my goal
Mhm.
ultimately is to have multiple places. I've been praying about this for a long time. I've been speaking to people for years. I really want facilities all over the US to help patients who want this, and it is really sad. Everybody knows somebody who has cancer. Everybody knows somebody who has died from cancer. Everybody knows somebody who's going through chemotherapy. Everybody knows somebody who has experienced this, and so the rise is exponentially growing, and you're right, it's not, I think the vaccines play a huge role in it, um, a huge role. But we've got chemicals in the air, we've got chemicals in our food, we've got chemicals in the soil, we've got chemicals in our water, we've got chemicals in our clothing, we've got chemicals in our laundry soap and our shampoo and our conditioner. I mean, you name it, and we are surrounded by carcinogens. And the fact that not everybody has cancer right now is a surprise, but you have to do everything you can in your ability, and that's really what we talk about a lot is, the choice is yours. There's things you can't control, but gosh, there are a lot of things you can control, and you have the ability um, to make that choice. We have choices in front of us. Every second of every day is a choice, and if you choose to live a life that's going to lead to disease, and then you get this diagnosis, it's no surprise. And so trying to prevent that instead of trying to heal from it once it's happened, totally different journey. So I'm excited. I this is where God wants me to be. I know that 100%. Um, I often wake up, are you sure, God, this is where you want me to be? Because I'm a total empath, and so my heart bleeds in this. And but this is my mission, this is my purpose, and I'm so grateful that I'm able to bring what Dr. Whiteside has invented to patients around the country.
That's amazing. So now this treatment, do people come does it have to be a certain level of severity of cancer? I know, like you said, you have your patients, but then you were like sending them there for like extra layer. So I guess a two-part question. Does it have to be more severe cases of cancer? And are there therapeutics that people can go and do? Like say they've taken the test to see if they have cancer genes, but they don't necessarily have cancer. Like what does that all look like on that spectrum for both those questions?
Yeah, I mean, the severity I don't think matters so much. A lot of patients
Mhm.
um, find themselves having failed all Western medicine can
Mhm.
offer when they come to his facility. So they're on their last leg. They're hail Jesus is what they call it, and so they've basically been told to go home and prepare. Um,
Mm.
so unfortunately, that's sometimes the stages that he gets them in, and I find that that happens a lot at my practice too. Is people want to use their insurance, they don't want to have to pay out of pocket. They're paying a ton of money to get insurance, and unfortunately, insurance is only going to cover what big pharma wants you to do because it's all about money. And so they exhaust all those avenues, and then they start seeking additional remedies because it's not working. So the stage that you're in doesn't necessarily matter. It's much easier to deal with it when it's earlier stages for sure.
Mhm.
Um, and as far as like having cancer genes but no actual cancer in the body, um, prevention is key. And so being aware if that's the case, there's a specific blood test that is required. You don't necessarily have to have it at your first round of treatment, but it is going to be drawn before you get your first round of treatment if you don't have those results. It's a blood test by company RGCC, and the blood test is called Onconomics Plus. It runs a little, almost $2,500 out of pocket. And what they do is they draw your blood and they look for circulating tumor cells and epcam cells. Once they find those circulating tumor cells, they'll look at how many they see per ml of blood, and if they don't see a lot, they'll have to add more milliliters of blood. So your test results will kind of show the severity of what's circulating in your blood. And then
Mhm.
this lab will then use everything they have possible to kill those cancer cells. So they'll test it against all the different chemotherapies. They'll test it against radiation. They'll test it against heat shock therapy. They'll test it against all these repurposed drugs. They'll test it against all these nutraceuticals. They'll test it against IV vitamin C. They'll test it against everything. And once they figure out how to kill your cancer cells, they'll then give you a report, and it will show a percentage of how well each thing, how effective each treatment was against your particular genetic makeup of your cancer. We know
Mhm.
cancer is oftentimes an overexpression or an underexpression of genes. And so these genes
Mhm.
get hijacked by these cancer cells, and then they're able to basically ride that and be hidden by other parts of your body that would normally see these cells as abnormal and cause apoptosis.
Mhm.
So we get this big report. It tells us all of the genetic makeup of your circulating tumor cells as well. And then Dr. Whiteside will look at the genetic makeup and then look at what things found in earth will block those pathways. Things like curcumin, things like green tea, things like I asked him about methylene blue. I mean, we look at methylene blue, modified citrus pectin, um, IV vitamin C, heat therapy, you name it. I mean, there's tons. It's massive. It's a huge report.
Mhm.
And then he'll formulate nanotherapeutics that is given via IV and intramuscular intratumoral injection, and it will he'll actually change he'll put a little thing on the molecules that the cancer cells actually want. So something that will help the cancer cells grow, but it's very minuscule, and then inside that molecule all the things that will kill the cancer. So you want the cancer to take it in. If you give it
Mhm.
something that it says, I don't like that, I'm not going to take it in, then you're never going to target it. So you want to almost lace it with something. It's called a Trojan horse. You want it to go after that. And then once that cancer cell has taken in that molecule, it then will die. So the treatment is
How
you
does
come
that
to
how
the
does that work? I'm sorry, how does that work when it to find using any form of, like, glucose or anything like that to bring it to the cancer cell?
glutathione. So glutathione, a lot of cancer cells will actually take glutathione and it helps the cancer hide. It helps shield it off from any mechanism to go after it. So this particular blood test will look and see, is glutathione something that's going to worsen your cancer? And if it is, then he's going to use that in a very small
Mhm.
amount. So that's what the cancer is going to think it's taking in is glutathione. But inside that molecule are all of the things that will actually target that cell.
Mhm.
Sometimes platinum-based chemotherapy drugs, the cancer likes platinum, and so sometimes you have to put a little platinum in there, and then it thinks it's taking in something that is going to help it because cancer is tricky.
Mhm.
It will it can if you keep feeding it the same stuff, it can become immune to that. And so
Mhm.
there that you can build a resistance, and this will actually look at multi-drug resistance percentages. So it will tell us, is this cancer like super smart and has this huge resistance to treatments, or is it not quite as smart as some other cancers? And so I mean, this blood test is pretty phenomenal. So it gives us a report that, I mean, to even be a certified provider to be able to order the blood test takes hours and hours and hours of training before you can even order it. And then to interpret it is a whole nother a whole nother ball game. So pretty impressive stuff. And and as science evolves, because there's science is not stagnant, it's not standstill. And I think what Western medicine does is it it doesn't allow for learning. It doesn't, we're taught the same thing now that we were taught 100 years ago when medicine should be ever evolving, and we don't do that. And so um, what we know now versus what we knew 10 years ago, I think a lot of the thought process behind cancer was that it was uh, genetics, it was DNA damage. That's not necessarily the case. It's multifactorial, and it has a lot to do with viruses, toxins, glyphosate, mold, um, heavy metals, vaccines. It's food. It's all these different layers that we never really put into perspective, which is why you'll have a really hard time finding an oncologist that tells you that your diet makes a difference in treating cancer. They often will say it doesn't actually matter. That's a total lie, but that's what they've been taught. So you and I know that it has a lot to do with it,
Mhm.
and definitely it makes a huge impact. Fasting is huge, trying to starve these cells, fasting, and it
Mhm.
will tell us that. It will actually say whether high protein diets are good or bad for that person's particular cancer. It will tell us. I mean, it's amazing. Like some of them, I'm like, hey, you need to take a hot bath a couple times a week because heat is
Right.
going to kill off your cancer. And there isn't just one protocol, right? It's multiple things because there's oftentimes multiple genes that are being overexpressed or underexpressed. Many, 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 but a lot of the supplements will block multiple gene expressions. So pretty cool stuff. And just, not where
Yeah.
I ever thought I would be, but so grateful that this is where God has placed me and hoping to help as many people as I can. Um, and it's yeah, because cancer it's going to far surpass heart disease, which I think has been the leading cause of death, uh, at least in America, for a very long time.
Yeah. And hearing you break that down like that, that's the beauty of what I mean, this is, I mean, safe to say this is more like a functional medicine type of approach.
Sure.
And that's the beauty of functional versus conventional. Everything with conventional is this one size fits all uh, conversation, right?
Mhm.
And you've heard it out of both of our mouths so many times when it comes to the human body, absolutely nothing is a one size fits all. And to your point, to what you're just saying, like high protein diet may be bad for somebody, it may be good for somebody. The hot bath may, it's an individual basis. And when I hear medical professionals like yourself speak like that, it just makes me so angry when I date back to 2020 and them trying to push this whole narrative of like this one size fits all. It's safe and effective for every single person, every age demographic needs to take this. You're crazy if you don't. Like the rhetoric and just the propaganda that's still being the ripple effect into 2026, how strong it still very much is.
Mhm.
And like I said, when you hear people like yourself speak from such a level-headed space, like common sense, right? Like your body metabolizes things differently than mine does. Like it's so first grade common sense to me. Like but yet the institution of medicine has made it this complex thing where it's like so hard for the average person to even try to understand it and figure it out.
Mhm.
But it's manipulation and brainwashing. I mean, that's what it comes down to, right? um
Absolutely.
how we came to this space of that, you know everyone who has this title of this diagnosis falls into this box, and everyone with that title diagnosis falls into that box, and there's no veering off. And you must practice for this one, you must practice within this guidelines, and that is it.
Mhm.
It's wild to me. It's insane, it's criminal, it's sad, it's infuriating, and everything in between. So in saying that, what John Smith from, I don't know, North Dakota wants to come, has to come see you in California. Um, what's he to expect? How long is he supposed to be there? I mean, obviously, I know the treatment's different for everybody, but are people coming for a week, 2 weeks, 3 weeks, and then they're given a protocol to maintain on their own once they leave you? Like, what does that look like? If you could take us to that a little bit.
Sure, sure. It's just 2 days, your first
Okay.
treatment, and it's you're maybe in the IV chair for an hour and a half to 2 hours, so pretty short. You come in, you check in, get vitals. We access a line, whether you've got a port for someone who's gone through chemo, or whether we just do an IV, a typical IV. And you'll get an IV bag of magnesium to A, prep the body, and B, some of the stuff in the nanotherapeutics can pull out magnesium. So we give you magnesium beforehand. And then we hang that bag. It takes 45 minutes or so to go in, and then we hang the nanotherapeutic bag. Same time process, and then you get 1 to 2 injections depending on um, what the protocol is, and the location of those injections just depend on what kind of cancer you have. So if we've got a blood cancer where you can't really target a particular spot, it's just everywhere, you'll get
Mhm.
intramuscular injection. If we can feel a lymph node or we can actually palpate your tumor, we'll go around the tumor or into the tumor or into the lymph node. You go home, you rest. Some symptoms that you might experience, you might have some fatigue. You
Mhm.
might have a little bit of nausea, and you might have some pain at the injection site. Um, Although those are some of the side effects, I have yet to have any of my patients experience those. Um, you come back the next day, we rinse and repeat. And then you get sent home with, I call it a goodie bag, but basically you're being sent home with a multi-dose vial of the nanotherapeutics to use in an IV for once a week IV infusions, a vial of the nanotherapeutics for intramuscular or intratumoral injection, and then a big, glass bottle of a liquid that's used as an enema, and you do an enema every once to 3 times a week. And the reason for the enema is the mucosa in the rectum is very vascular and it's 100% absorbable. And so, getting an enema in, you can get a lot more therapy through an enema than you can orally. And the bypass of taking a supplement, you and I take a supplement, maybe 15-20% of that supplement we're absorbing, and the rest is going to waste. And so, there's no
Mm.
waste, and then we don't a lot of my patients doing repurposed treatments for cancer where they're popping 30, 40, 50, 60 different pills a day. So we can minimize the amount of pills they have to take by doing enemas. So you get enough for a month, and then the hope is that they come back the next month and we can see them and evaluate them. And then sometimes Dr. Whiteside will kind of up the ante a little bit and make things a little bit more potent depending on how you tolerated it. Some of my patients just can't come back, depending on where they're located and time
Mhm.
restrictions and what they're doing. And so we can make sure that they get that and set up nurses or someone who can administer those IVs to them. So the location in Tennessee is absolutely gorgeous, and you drive into the
Mm.
property, and the Holy Spirit is so overwhelming. And it's just, I tell my patients, it's something that I can't put into words. The beauty and the love that you feel there, and that was what a lot of the feedback was from my patients that were there, is they said, "I just felt so cared for. You guys
Mm.
opened me in with, open arms and welcomed me in with open arms, and I felt like you guys heard me out where when I go to the oncologist, I'm just a number. I'm just a chart. I'm just I don't mean anything. I'm just another 10 minute consult or appointment." Um, and they do. They pray over you. They pray over the day. They pray over the facility. They pray over your therapy. They pray over everything, um, and you feel it. You really
Mm.
do. And so it's a glorious experience, and they'll continue doing it out there in Tennessee. But to be able to expand that, and my goal, my vision, what I see, and what I've been trying to do for some time is have multiple spots all over the US so patients don't have to travel that far to be able to get the treatment that potentially
Mhm.
could save their life.
Mm. And are there ever situations where, again, correct me if I'm wrong, you said earlier this is more for people that have been written off from their doctors in a sense?
Not necessarily, although that's often when people start seeking alternative
Mhm.
treatments, but not always. So someone can get the diagnosis of cancer and they've done absolutely nothing in the Western medicine world. They just know that they never will. So they come in very early stages.
Right.
Although these days we're finding that at time of diagnosis, it's often stage 4, which is
Mm.
pretty scary and not normal, but becoming. Society likes to delete the past and or history or government, whatever. So they're going to say, "Oh, that's
Yeah.
pretty typical." But normally, you find an early onset cancer and you treat it. But a lot of cancers, patients being diagnosed at stage 4. But you could be in there at stage 1, and absolutely, that's better.
Yeah, of
That's
course.
actually better. That's easier to go after. We don't have
Yeah.
as many circulating tumor cells and epcam cells to have to kill. And so,
Yeah.
um, the earlier you can get in, the better.
Now, are there situations where people are joining both? Like, can this therapy complement somebody going through chemo or radiation, or it's one or the other?
Absolutely. There are some that are doing chemo and there are some that are doing radiation. In fact, some of my patients are in that boat. Um,
Hmm.
the nice thing with this blood test, because oncologists will just throw different chemos at them without really knowing how effective they're going to be. And if you don't have
Hmm.
one that's going to be very highly effective, then it's going to be extremely toxic instead, because it's going
Right.
to be toxic regardless. But the goal is that it's going to be more therapeutic than toxic. So I do
Hmm.
have a handful that are doing that. Um, and this test will let us know, is your oncologist on doing the right thing, or do they need to change what they're doing because now we've got what your cancer will die from.
Right.
But no, you could do very early stages, and that's recommended. So um, yeah, I mean, I wish we could flip things around and say that, someone's paying for insurance and this is the route they wanna go and this
Uh,
is the therapy that they want and insurance will cover it, but that will never be the case.
yeah.
There are some cancer centers, and I've toured many, who are, extremely expensive and just completely out of reach for patients. They
Hmm.
have to sell their home, they have to, take a second mortgage, they have to, whatever, and it's not realistic. And this one is the price is much more reasonable. Patients are looking at anywhere between 5,500 to 6,500 a month, um,
Hmm.
and looking at anywhere between about 3 to 6 months is their average, how long patients are on therapy. And so, although it's not cheap, um, and I wish and pray that somehow insurance will cover this, it's not when you're talking about life and death and the
Of
potential
course.
to
Yeah.
heal. Um, at least it's not so far out of reach for a lot of people.
Yeah.
And maybe that's something that we end up doing, is we end up getting donors and we end up getting um, people who will contribute to a bank where patients who just cannot afford it but absolutely need
Yeah.
it can come, and that would be a mission that I would be 100% on board with.
That'd be
um,
amazing. Yeah.
it'd be just amazing. So is that
Yeah.
something? Yeah, I mean, I know these guys, they tell me all the time, we'll never turn anybody down. They do offer no interest financing as well. But if
Mm.
we could, and that may be down the line as we start looking for donors who are willing to contribute to a fund for patients who just can't make those ends meet. My office
Mm.
manager, I love her, and she's already calling all the hotels and getting block rates for patients,
There
and
you go.
so trying to get discounts at local hotels. And the nice thing with California, although it's probably the most communist state, is that the weather is beautiful year round.
Yeah.
And so going out to Tennessee, I was there in December, it was freezing cold and there
Yeah.
was that cold front, and so travel can be very difficult with flights often
Yeah.
delayed and you're stuck, and this is until something big happens, California is still pretty easily accessible.
Yeah.
And so that the weather would not be a problem.
Yeah.
We're 5 minutes from the beach. There's healthy food here,
Yeah.
so it's a vision I've seen. God's opened that for me, and these guys are exactly who I would want to team up with.
Amazing. That's
Yeah.
amazing. Um, yeah, that's something that was running through my head I'm glad you said it. Yeah, there's so many people out there that would contribute money to a cause like this, to
Mm.
have like that pool there for people that do not have the funds like that. And, if you're somebody too listening to this and you're like, oh my God, I don't have that kind of money. You know, when you're faced with a sickness, and I always joke around too, like, if you just have the passion of wanting to get healthy but do not have the finances, most people will ask for help when their back's against the wall and they're sick. And then there are people who won't even ask then. But I always say, like, why even wait for it to get to that point? If you can't even get started, like, there's so many generous people out on in the world
Mhm.
that are willing to help, right? Um, like you got to speak up, you got to ask. No one knows you need help if you don't ask, right?
Right.
And you know, that's the beauty of the power of social media and the internet. There are so many people that you can reach out to that may be able to point you in the right direction, may be able to create awareness around your situation. Um, you know, God, we would love to bring you on to something like this to share your story if you're having hardships and your back's against the wall, to get
Mhm.
people to help you. Like, so it's you're never alone. Whoever's listening to this feeling like overwhelmed, just if you heard, if you're financially like just strapped or whatever, like you're never alone. It's like, so everyone needs to know that there's always somebody out there willing to help, to get you to get into, one-on-one meeting with Sarah or her team to do what they're doing. Like there's always possibilities, and that's
Mhm.
just important for that to be said, and for each and every person that's listening to this to know that wholeheartedly. Um, so you mentioned that the treatment all in lasts about 3 months, 3 or 4 months. Is that what you said?
3 to 6 months.
3 to 6.
So
Okay.
yeah, and the way that we monitor, because a lot of patients will say, "Well, how do you know if it's working?" We
Right.
do use the conventional, MRIs, CTs,
Mm-hmm.
PET scans, but really what we do is that blood test gives us the number of circulating tumor cells and epchem cells that we have, um, in our bloodstream. And so we repeat that test about 3 months in. You don't have to have that super expensive, almost $2,500 test. The secondary test is about 900, and we're just looking at the number of circulating tumor cells and epchem cells. So we want to see that drop, and we want to
Mm.
continue to see that drop. And when we see that basically go to zero, we know that there's no longer circulating tumor cells or stem cells in the blood. And a lot of patients who go through conventional Western medicine treatment and get this diagnosis of remission, negative PET scans, negative CT scans, everything's looking good. Um, there's a window about 5 years that a lot of patients end up with cancer again. And the
Mm-hmm.
problem with that is that no doctors are looking at circulating tumor cells. Are there stem cells in the blood that are often slow growing that the chemotherapies aren't touching? And if
Mm-hmm.
there's circulating tumor cells in the bloodstream, it's not a matter of if, but when that will form another cancer. And so that's what we look
Mm.
for. We want to see that there's no longer anything in the blood, because we can go after the primary tumor as long as there's nothing else in the blood. We're we're doing really good. And so that's how we, besides the scans and all that stuff that insurance covers,
Mm-hmm.
that is how we monitor the treatment. So patients need to expect another blood test and potentially another one after that. It really opens my eyes. This particular lab will actually run blood on individuals who don't have a diagnosis of cancer to look and see if they have any circulating tumor cells. So I will be
Mm-hmm.
taking that test. I don't,
I would love to do
I
that.
I live in the world of cancer, so I'm always like, I should probably be more proactive than reactive. So that is
Yeah.
possible for people to do as well. And I do have some patients who their spouse has decided to do the test for, to look and detect. It's called oncodetect, to see, do you have circulating tumor cells? And if you have circulating tumor cells in your blood without any known primary diagnosis, man, that is easy to get, right? You
Mm.
that is those are the ones when you can catch it at that stage, um, you're doing good. So it's
Yeah.
when you catch it at that late stage, like most things,
Sure.
it's taken over, and it's much, much more difficult to get the body back into remission.
Sure. And I'm always whenever I have a conversation like this, I'm always reminded. It's just so sobering, in the sense of like you literally have to be out of your mind as a person to put things into your body that can cause disease. You know what I mean? Um, when you just look at the odds and you look at the statistics, and you see what's going on, and like we touched on, you become aware of like how many things are out of your control. It's insane to me that the things that are in your control, when you don't pay attention to those details,
Mhm.
it's tragic.
Mhm.
And I mean, that's one of my greatest passions in doing what I do, is I try to get as many brains that I can brainwash in a sense to seeing it that way. Because it's like, again, there's so many things out of your control. So the things that you can control, why aren't you like giving that 100% your all? I mean, nobody, I've seen many people laying in hospital beds, and one thing that I always want to be sure, like, if I ever had to get to that place, look, we're all gonna, Father Time is waiting for none of us. So at some
Yeah.
point, I'll be in some kind of a situation like that later on, way later on in life. But I just don't want to ever lay there being like, man, I should have tried this for my health. Why did I drink so much of that? Why did I think so much negative like that? Why was like, nobody wants to lay there with regrets, and you
Right.
don't want to wait until the levee breaks, right? Like, you want to make sure you're doing as much proactive activities in your day-to-day life that you can possibly do,
Mhm.
to avoid this. And the beauty of, like, I would love to take a test like that, because there's a lot of cancer in my family. I mean, my mom,
Mhm.
dad, and sister are all cancer survivors. I'm, knock on wood, the
Mhm.
last one standing to my knowledge.
Wow.
um, but I hope and pray that in my 26 years of living that I've lived, and what I keep investing into my health, that it's it's doing its job. But again, then there's all the environmental stuff, right? So, um
Yeah.
we just never know. um but in saying that, let me ask you this, like, with this approach, Dr., what's his last name?
White side.
Whiteside. So with his work and with what you're doing with this team, is there, does it ever get to a point, like, say you hit the 6-month mark, 7-month mark, are you guys confident in, like, well, we're gonna, you know, we're gonna keep trying to figure this out? Or does it get to a point, like, where there's, a dead end sign, like in conventional medicine, like, look, we've exhausted all our options, like, there's nothing else we can do for you? Like, does it ever get to that point in what you do? Or is there always a different, is it like a labyrinth in a sense, right? Is there always like a different kind of like direction that you can go with this? Or what does that look like for somebody?
Yeah, I mean, first, God's in control, right? So
Yeah.
for us to say there's a dead end, there's never a dead end. There's
Hmm.
always a way out, whether it's here or in heaven. I think a
Hmm.
very small percentage of his patients he has added or recommended chemotherapy on top of what he's doing. He said about 20 patients out of, I don't know, 450 is kind of what he said.
Hmm.
That's a very small percentage.
Yeah.
The nice thing with the blood test is that you can say this particular chemotherapeutic drug has a very high success rate at your particular cancer, and this chemotherapeutic drug, and used correctly, will have minimal side effects. So some chemotherapies they're not all created equal. Some are extremely
Hmm.
toxic,
Yeah.
with severe side effects, where others are much better tolerated with minimal to sometimes no side effects. Everybody goes on ivermectin. Everybody
Hmm.
goes on either fenbendazole or mebendazole. Everybody. Um,
Hmm.
so that is across the board. And
Yeah.
then what we do on top of that just depends on their genetic makeup of their cancer. Um, I don't think anyone in this clinic or anyone in this group gives up. Will never
Right.
give up. I'm not a quitter. You're not a quitter. I think that's why we stand where we stand, and we stand in the gap between truth and where everyone is trying to lie. And um, so it really is in God's hands. And these
Yeah.
men, um, they never take the praise. They never take the glory.
Yeah.
When someone's in remission, it's thank you, Jesus. Thank you,
Hmm.
Jesus. And so
Hmm.
so incredibly humbling. Ego is checked at the door. Dr. Whiteside is absolutely brilliant in what he does, and I have never heard him not give glory to Jesus.
Mm.
So it is where I would be I have to think about what I would do if that were the path that God put in front of me. Everything is for His glory, and so regardless, if my path and my purpose is to teach people about Jesus, because this is the end of their time here on this earth, um, then that's what my job is to do. But
Mhm.
I think quitting is not in it's not in my wheelhouse. I don't think it's in theirs either. But again, not everybody. It doesn't work for everybody. Um,
Yeah.
Nothing works for everybody. And I tell this to patients, and then there's your teaching, and there's two promises in life. Death is a promise. We all will
Mhm.
die. This
Yep.
body will eventually get to the point that it no longer will be here. Um,
Yep.
whether it's because of old age or whether it's because of some tragic accident that happened, it's out of my control. There are things that are in my control. So that is a promise. The day that we're born is that we will eventually pass from this earth. The other
Mhm.
promise is salvation. And so those are two things that are guaranteed. If you Death is guaranteed and salvation if you believe. And so maybe that's also part of this, is just the ministering of uh,
Mhm.
uh, the Holy Spirit and teaching about that. But yeah, I mean, but yeah, and being proactive, Frank, you're right. Um, Man, there's so many things we can do to I tell patients, you can either cause a disease or cure a disease by what you put in your mouth.
Mhm.
And it couldn't be more true.
Yeah. And what we allow to permeate on the movie screen in our mind on a day-to-day basis, it's crucial. I had a realization the other day, um, and it's like what you're saying from a spiritual sense, death, all that, absolutely. But when it comes to the human aspect of life, one thing that I heard so loud in my head last week, as a matter of fact, is just this whole concept of time, how time waits for none of us. And I heard loud in my head, all your life when you're growing up, you hear from like elders. How old are you? Yeah, this happened to me so many times through my life. How old are you? Oh, I'm, blah, blah, blah. Oh, you're a baby. You have your whole life ahead of you. Like, like it, it's given this concept that we have time. And what I heard so loud in my head is that I am never going to tell my son that he has time, meaning that it goes so fast, it waits for none of us. And if we put off everything and anything that we want to do, that's a passion, that's something we've always wanted to do, a place we've always wanted to go, a thing that we've always wanted to do for ourselves, that whole concept of like starting to put that into someone's mind at a young age, like, oh, you have all the time in the world. It's like you don't, like, you don't. All you have is right now. You have this moment, and it's like that truly is all that matters. And putting something off for years down the road is insane, because you're not guaranteed that. And it just does something. I just realized that, like, it does something to the human brain to put us into this position of like, oh, I have time. I'll get to it when I get to it, and I think that, I know for myself, like, as a father to an almost 8-year-old little boy, I'm very clear that, like, whenever he comes to me with something, I'm gonna always advise him in going, "You wanna do that? Do it now. Like, you don't have time to waste. Do it now. Do it right now. Like, do it right now." Like, I don't want him to hear that coming out of my mouth, "Oh, you're a baby. Like, you'll figure it out. Take your time. Like, enjoy your childhood." Like, and there's valid points to, like, enjoying your childhood, of course, I'm not saying that. But I just, I'll be 48 in July, and, I trip out, like, this year is the 25-year anniversary of 9/11. And, I just think 25 years from now, I'll be in my early 70s. And it's like, I think 25 years ago, I was like, what, 22, 23. And it's like, it's that whole midlife crisis thing. You just
Yep.
realize, like, that midpoint, you're like, wow, it, it,
Yeah.
truly waits for nobody time. And to think that you have all the time in the world to take your health into your own hands, to do something that makes you happy, to do something that puts a smile on someone else's face, to do something that makes somebody else feel loved and cherished and important, whatever it is, an animal, like whatever it is, like you don't have time. You don't have
Mhm.
time. And I don't, and
Mhm.
again, I'm not, and I don't make that statement from a depressive, negative place. It's from a place of like, be here in the moment right now and do what you must do right now. You want it, get it right now. You want that?
Yeah.
Go after it right now. Stop waiting. Like stop waiting. Um, and I know that there are a lot of people who could be listening to this right now that maybe they have a stage 3, stage 4 diagnosis, and I guarantee you those types of people realize what I'm saying, right? It's like it's not until like your life flashes before you that you're able to realize that. I think I'm able to realize these certain things because I talk with sick people a lot, right? Coaching them, trying to help them get healthy. So, and that's where that download came from me the other day after having a session with somebody who is battling an illness but wants to change their lifestyle. Um, and it just, with again the whole midlife crisis thing and all that, it just all kind of like spiraled into my head that day. Like I heard it so clear in my head, like we don't have time. We do not have
Mm.
time, like because it's not waiting for us. um, and anyone who finishes a conventional treatment, even for cancer, if they're not talking with somebody like you, Sarah, or your team of doctors, they're not they're not walking away after their last. Obviously, most people that are in remission, they go for checkups every, 3 months, then 6 months, then a year, then 2 years, depending. But every time they leave those office visits, that regular conventional school of thought medical doctor is not telling them, "Hey, when you leave here, like, what are you doing? Like, what are you thinking? What are you eating? Like, where's your faith at? Oh, you look good, Jim. Keep doing what you're doing." And
Yeah.
they don't know what they're doing. They just see their markers right now, which are just a test to show you where the person is in this moment. But you don't know what those person's actions of what they're doing on a day basis of where it's going to take them 6 months from now. And the doctors never ask that question or try to get an understanding of that patient of what they're doing. So it's so tragic to me if you're a cancer survivor and then your patterns and habits go back to the same exact thing way as they were
Yeah.
pre-diagnosis,
Yeah.
right?
No, yeah. Yeah. That
Why?
cannot. You
No.
know, yeah, I think that there's some psychological component with that, and to add to that a little bit, um, because there's a phrase that everybody has heard that stress kills you, and
Mhm,
and it literally kills you. And a lot of the patients that I was able to meet, um, a lot of them had some sort of traumatic event that happened to them 3, 5, 8 years ago
mm,
that was probably the point in their body where metabolically it started to fail. Whether it
mhm,
was a divorce, whether it was a loss of a child, loss of a job, a move, an illness, a loss of, whatever it was, there was some sort of traumatic event a few years prior, and they can all look back and go, "This is what was happening in my life when my body broke down." And so no one is immune to that, right? I have gone through 2 divorces, and one very traumatic and quite painful, and you have to find ways and avenues to be able to um, get through that, whether it's seeing a therapist, whether it's grounding, whether it's exercise, whether it's eating healthy, whether it's spending time with loved ones, whether it's laughing, whether it's traveling, whatever it is, you have to be able to reset that, because if you hold
mhm,
on to that, if you allow that to eat you up, if you continue to have hate in your heart and resentment and unforgiving, um, man, it's going to eat you up. And
yeah,
so, Jesus died on the cross and he forgave those who were literally murdering him and terrorizing him and making him suffer. And here he is my Father, forgive them, for they know not what they've done."
Mhm.
And if he can ask for forgiveness of the people that killed him, we need to be able to forgive those that have hurt us. And it's not that we forgive them because we want them back in our lives. And it's not because we forgive them because um, we're, we're going to, it's not for them.
Right.
It's for you.
Right.
It's for you. And so you hear these stories of these people who've gone through traumatic events, and and it really is a ministry. It really, really is. And so trying to help them through that process, because once they can let go of that pain, the hurt, um, whatever it was, they can
Mhm.
start healing. So really the practice and what they do at this clinic and what we'll implement here, it is mind, body, soul healing. You
Yep.
cannot heal the body without healing the mind and the soul. It truly is
Yep.
all encompassed in one. And that really is what it's all about. And so yeah, it's so healing and not going back to ways that led to what was the start of your disease process.
No.
Forgiveness, healing, and moving forward in your journey is all part of what this practice and what their practice will be focusing on.
Yeah. Yeah, and, if there's a person that's wronged you and you're carrying that resentment and you've seen signs in that person of selfishness, narcissism, I'm here to let you know that there's a very high probability that that person is not even thinking of you and you're the one holding on to it. So it's only killing you, right?
Really is.
So it's so important to realize that, like, how I always say this, like, it's important to realize, like, how little other people really think about you in that sense, because everyone's so consumed in their own stuff, especially if it's a selfish person, narcissistic person. They're not thinking of anyone, especially you, but themselves.
Mhm.
So,
Mhm.
and if you're walking around carrying something that happened a year ago, 5 years ago, 10 years ago, 20 years ago, I mean, it's only killing you. I mean,
Mhm.
you know, I laugh. I have a very good friend who's Jewish, and I'm Italian on both sides. And the Jewish and the Italians of the old school generation are very similar. In the sense of, like, if they will take a grudge and they will take that to their grave. The old school Italians, and it's just how they are. Like they will. You cross them like 40 years ago, they're not letting it go. Like, and
Mhm.
it's funny, but it's also very, very sad because you see how it affects their health. You know what I
Mhm.
mean? It's metaphysical, right? Like, everything's energy.
Mhm.
I went to a seminar many years ago in LA. It was a doctor from Germany called Meta Medicine, and he was touching on how certain emotion, the emotion of grief affects your heart, the emotion of anger affects your liver, yada yada yada. So I mean, everything that you're holding is hurting you, right? So
Mhm.
just like we need to detox our body of toxins, it's the emotions as well. Everything needs to be let go in that sense
Mhm.
to be able to have any kind of a success story of healing. As you say, the mind, body, and soul, all of those pistons need to be firing, or else, you're gonna just be a hamster on the hamster wheel, right?
Absolutely. Yeah. And
Yeah.
you have to let go of thinking that forgiveness means that you're allowing them back in. That isn't it.
No.
Because I had that was me. Like, how can I
Oh.
forgive? And they keep hurting me and they keep
Yep.
attacking and they keep and they keep and they keep and they keep. And I think in the Bible, who was it that said, how many times do I have to forgive? And it was like,
Hmm.
it's endless.
Yep.
There is no number of times you have to forgive. You don't have to let them back in.
Let
But
it
for
again.
your
Let them
own,
go.
yeah, yeah, forgive
Let it
and let
go.
go.
Let it go.
And that's the only way that you can truly heal, and be
Yeah.
completely done with that situation. So,
Yeah.
yeah, yeah.
Absolutely. So, Sarah, I mean, before we wrap this up, is there a timeline on this? When do you think realistically people are going to be able to come to California and get treated?
Well, we can start it now just in my clinic.
Okay.
So we talked about it because we were supposed to do a trip to Vegas in April, And so we
Mhm.
kind of said, are we going to skip the April Vegas trip? And so the office 2 doors down will be up and functioning 60 days or less. But that
Oh,
doesn't
wow.
that should not stop us from being able to get patients to come out to California. I've got multiple places in my own office space that patients can come and get this treatment. So we literally could start it now, but that secondary IV infusion center will be up and running in 2 months or less.
Cool. And I know
Yeah.
you've said several times that there's a waiting list for people to get to see you, but if there are people that are in dire straits or like something of this nature, is there a different way that they contact you, or how do they get to you sooner than later if time is of the essence?
Yeah. So I'm getting another PA on board. She starts next week. So training will begin next week. And
Okay.
with the help of Dr. Whiteside and his expertise, um, because it will be less time that I have to spend with patients, we're able to implement his protocol, get this blood test. I'm hoping that we can start taking additional patients. We do have a wait list, and we'll be bringing these that are on the wait list into the clinic in the next handful of weeks. Um,
Mhm.
so we haven't made that announcement that we're opening up to more patients, but we are opening up to more patients. So
Awesome.
yeah.
Awesome. And obviously, everybody following on social media, I'm sure you'll hear updates. We'll obviously highlight it
Mm.
here as well. Um, and that's it. So, Sarah, God bless you as always for the work that you are doing, for the call that you have answered, for the people that you are healing, allowing God to work through you to heal them.
Mhm.
Takes a very humble person to do what you do. And yeah, just keep doing what you do because the world needs it. That's for sure.
Thank you.
And absolutely. And thank you everybody for tuning in. Again, you can always find the Overstood Human podcast on Spotify, Rumble, YouTube, and X. All full episodes are live every Wednesday at 9 p.m. Eastern, 6 p.m. Pacific. Um, and then every Wednesday night, when our schedules permit, Sarah and I are doing Facebook Lives around 5:45-ish
Mhm.
Pacific,
Yeah.
8:45
Yeah.
Eastern, give or take. Uh, life gets crazy, but that's always the intention. And that's it. Spread the word. If you are catching these full episodes on either one of those platforms, please, please, please be sure to subscribe to the channel. That just helps with the algorithms, get the word out. We're not stopping these anytime soon, and we just want to continue to help create this shift on planet Earth as best as we can. So, in saying that, I'll give the mic to you, Sarah. I'm Frank Tortorici. Thank you for joining us.
Thank you. My name's Sarah Green. And Frank, again, thank you so much for what you do. You are a godsend, and I'm so grateful that we have been able to get to know each other and do this. It really is an honor to be in the same, not room, but on the same screen with you. And so thank you
Thank you.
for being a part of that. It truly is a blessing. So I look
Thank
forward
you.
every Saturday. I'm like, what do we get to talk about? So thank you for
Likewise.
bringing light to a world full of darkness.
Thank you. Thank you.
Yeah, and God bless.
Well, God bless. We'll see you guys next week. Thank you.
Thank you for watching the Overstood Human Podcast. Be sure to join in next week. This podcast is for informational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician with any questions you may have regarding a medical condition. Always consult with your physician before starting any exercise program or doing anything contained in this podcast.